Hey guys, Dr. Julia. I'm going to show you what really good mobility looks like, okay? That's hard. Okay, my video this week is on mobility. And this is really important to me because I don't know about you, but I would like to be independent as long as I possibly can. So with the current events and the things that are happening in the world, I think it's like super important to make sure that we're being really, really active no matter what we're doing. And it's just sad to me that so many people succumb to joint problems and things that inhibit them from living their lives. That's not normal. That's really common, but it's not normal. So I'm gonna give you sort of my take on it, which is kind of harsh, but it's reality. And that's the number one predictor of whether or not you will go into a nursing home when you're older is mobility. When you lose your mobility, you lose your life. If you can't do things on your own and you depend on other people, you will probably not be able to live by yourself for very long. So the number one way to make sure that you keep your mobility is, number one, this is gonna sound super woo-woo, but again, it's me, whatever. Joint pain or problems with moving joints, whether it's in your spine, whether it's in your shoulders, wrists, elbows, ankles, hips, all has to do with restriction, okay? Physical restriction and mental restriction. So there is a physical cause, but so often people poo-poo the idea that emotional restriction or emotional pain or trauma does not affect you physically, and that is absolute bull honky. It absolutely does. So different areas of the body have different meanings, and you know that this about me, that I really believe in it, because many times when I kind of dig in and ask questions, I can get to sort of the bottom of it. So hips and knees are restrictions by other people, left side female, right side male. And restrictions in your upper body oftentimes also refer to specific situations like work or family, somebody that you're close to and carrying their stuff, like keeping your judgment on what they do in your body. Elbows and wrists are stability, but also joint like restriction. So restricting access, not allowing, not bending, unable to bend. Same with your foundation, which is your legs. Inability to bend is the number one reason why people have knee pain. Whether it's a mobility issue or it's a problem on the inside of the joint, the inability to bend and flow with how things flow is very typical. Being stuck in your ways, being very set in your ways. And that's a very common cultural thing for the Midwest. So keep these things in mind. Just even doing some simple squats. I don't care if you have to hang on to the back of a chair and spread your legs wide apart and do, a 45-degree angle. It doesn't matter. You have to start somewhere. So walking, if your joints are an issue, you're probably not going to go running, but fast-paced walking, even just regular walking, Biking, those are things you can do to improve your mobility. And if you're not already doing something, but if you are, and you're going to the gym every day, making sure you're taking care of those joints with proper nutrition. I like collagen. That's my number one go-to for joint health. Also fish oil. Vitamin D is used in all cell receptors, so of course that, and building bone and tissue. Magnesium for muscles. And you can ask me directly if you have any questions about that. The reason why I did the wall squat is because it was a challenge. I did a reel yesterday on Instagram, and I just wanted to show you that is what that's what proper mobility looks like. We should all be able to do that. Am I gonna say that it was easy? It wasn't. It was not easy. I definitely had to force myself, but I test myself every once in a while to make sure that is my standard of mobility. And I'm going to continue to do that until there's a different standard. So I highly recommend that if you know you have some joint restriction, that you either do something about it or you ask for help. And I would be glad to help you. Have a great Wednesday, everybody.